Public health officials are sounding the alarms: rising coronavirus hospitalization rates, rising visits to doctors, increasing transmission rates. 1 in every 140 people in LA County might actually have the coronavirus, the virus that causes COVID-19, the disease that has killed at least 534 human beings in Los Angeles County in a matter of 5 months, and infected more than a confirmed 116,000. But as LA County's new wave of infection grips the region, a question has emerged: if the spike in cases so severe, why isn't that reflected in the death rate, which continues to fall? In fact, the county's fatality rate went from 4% in late June to 3% on July 4th. And if you look at the national picture, the case rate is going up but mortality rate is going down, too. LA County Public Health Chief Barbara Ferrer pointed first to nursing homes. The rolling 7-day average of deaths at skilled nursing facilities has been on a steep decline since late June, a bittersweet silver lining amid all the sobering stats of late. More than 1,700 people who have died in LA County were residents of skilled nursing facilities, and at one time they were the majority of cases. But that has changed. Now, as the county's public health department reported on Monday, half of the people who are positive for the virus are now between 18 and 40 years old. And hospitalizations for people 18 and 40 years old have also increased from more than 10% of hospitalized cases in April to about 25% in July. There's been quite a shift over the last 3 weeks, Ferrer said Monday. The percentage going to hospitals for the 65 and older group has gone down. In fact, Ferrer said there have been no new cases at skilled nursing facilities in the last 14 days, once a hot spot across the nation. Ferrer suggested that the fact that the newly infectious are younger might mean they could be more resilient to the virus, though she noted with caution that younger people can succumb to the disease, too, especially those with underlying conditions. But they are a group less likely to die, Ferrer said. Still, though, from the governor's office to Ferrer's, there's caution in assuming that the data will hold up. Ferrer noted that while nursing home deaths are down, there's concern that a result of community spread could mean more infections amid the people who work at such facilities, and those who contact the elderly. Officials are monitoring to make sure that doesn't happen. And for weeks, public health officials have sounded the alarm about younger people who decided to not engage in social distancing, noting that they need to be mindful of who they might be exposing to the virus, who might be more vulnerable to it. Ultimately, we'll know within a few weeks, because death is a lagging indicator. The real factor that is playing into the numbers we are seeing now is that we often have a lag time in deaths, from when we start seeing increases in hospitalizations, Ferrer said.